We have Amber Kellen, who is the Director of the Urban Health and Homelessness Services Department at the Toronto Neighbourhood Group. And the department places significant value on people's lived and living experiences of homelessness and substance use. And to this end, they employ over 250 peers to work in varying capacities and also provide a wide variety of services and programs, including a drop-in, primary care, nursing, supportive housing, harm reduction, substance, and outreach. Amber has a Bachelor of Arts and a Bachelor of Social Work degree from York University and a Master's degree in Public Policy and Administration from Metropolitan University. And prior to joining the TNG, Amber worked for the John Howard Society for nearly 22 years. She's co-facilitated a course called Homelessness and the Canadian Society at Toronto's Metropolitan University through their continuing education program. She lives in our neighborhood with her husband and 13-year-old twins. Welcome, Amber. And with Amber today, we are so delighted to have Andrew Neelands with us. And he is a peer worker with TNG. And he became more acutely aware of the increase in people experiencing displacement and distress in his community and was able to find opportunities to help by volunteering in various vaccination programs and at the local drop-in at St. Stephen's and the Fields. This led to an opportunity to work with the Toronto Neighbourhood Group, directly supporting people experiencing homelessness, health challenges, and addiction. Andrew tries to bring his skills and experience dealing with addiction and mental health issues, as well as a 25-year background in software development, to what he hopes will be a second career. So join me in welcoming our speakers today.
I'm so short. I'm always reminded of how short I am when I come up to a microphone. That's okay. I'm good now. Thank you. Good morning or afternoon, and thank you so much for having me and Andrew today. I am going to sort of let Andrew, do you want me to use my slides? We don't need them. We can share them. I'll just talk to you. It's totally fine. So I'm just here to talk a little bit about the neighborhood group. And is that better? Okay, I'm just here to talk a little bit about the neighborhood group. So I've been at the neighborhood group for just over 2 years, 2.5 years. And some of you may have been familiar with what was formerly known as St. Stephen's. So St. Stephen's has amalgamated with 3 other organizations now, including Central Neighborhood House from the east, Central Link in the northeast, of course, St. Stephen's, and now Kensington Bellwood Legal Clinic in the downtown west. So we're very excited about that new addition to our family. The organization has over 1,000 staff. Our department alone has about 250 people with lived and living experience that we employ in various capacities. And we offer a wide range of services from we have 12 child care centers now. We're the largest housing provider of seniors independent living. So there's a huge, huge suite of services, really from cradle to grave, as they say, because this agency has been amazing in terms of focusing on anti-poverty and organizing around these types of social justice issues. So at Urban Health and Homelessness Services, we are a community health provider. In our department alone, the budget now has really quadrupled since COVID, so it's now about a $16 million budget just in our department. Fortunately and unfortunately, most of those dollars are attached to specific programs that expire in time. So few of our programs are forever and ever, although we're very grateful to Ontario Health in situations where we do have some base funding. We provide services all across Toronto. And on the slideshow, I won't read them to you, but on the slides deck, you'll see sort of different quadrants representing different kinds of work that we do. But for the purposes of our talk today, I'm probably going to focus a little bit more on our Peer Leadership Center and some of the other partnerships we have in the community. So, as mentioned, many of the folks that we employ are people that identify with lived and living experience. And our sort of dream at one point is to create this business plan and have an entire social enterprise model for peer workers to be available to other organizations wishing to hire folks with that, who value that experience, and we would provide both supported opportunities as well as the supervision, the training, all of that. We've had a few little experimental opportunities. We had a partnership with Via Hafta for a little while, but I'm going to have Andrew talk with you about some of our larger opportunities with UHN specifically. So one of the things that we do best, and one of the things UHHS is known for in the community, is the training and support that we provide to people with lived experience to really incorporate them into our work. So almost every single one of our programs includes people with lived and living experience, and especially over the last couple of years, there's been a huge emphasis on the needs of people who use crystal meth and stimulants in the community. There's a lot of fear, stigma, and discrimination associated with that particular substance and people who use those substances. So we're working very hard. We're one of the only providers of a crystal meth drop-in program in the city. It is so calm, you would be shocked. And one of the most amazing things is sometimes when people are utilizing stimulants, they become very focused. They want to do things with their hands. So we've been able to combine that with a bike repair and small appliance repair. And it's incredible to see. So I'm very proud of that accomplishment. I do want to have Andrew spend most of the time talking with you because he gets to actually be out there and doing things that are very exciting. So I'm going to welcome Andrew, and I'd like him to maybe share with us a bit about your experience both in the hospitals and as recently as midnight on Friday at some of the encampments that you've been helping us to support. So thank you very much and welcome, Andrew.
Is pointing it enough? I can project. If I can be heard, then that's fine. It's probably easier. I won't hit it this way. I see. Is this better? Okay. I have a face for radio. I should be good with a microphone. My name's Andrew. I'm extremely proud to be up here at TNG. It has been an incredible experience, and I hope that I can share some of what that experience is like from the perspective of a peer. As Amber said, we're definitely chosen for our experience, but our experiences are completely distinct from each other. If you meet one peer, their experience might be like mine is primarily having addiction issues and mental health issues and trying to learn what the word concurrent means in a medical context. For other people, there's been much more, distinct and pronounced. But the thing that all peers have is a real desire to become useful and to reintegrate and to be useful and valuable parts of a community. And what TNG is able to do is to give us ways to do that as our priority, so that we can go and do the things we wish somebody else had done a few years ago, with the full backing and support of an organization that has some extremely well-trained and well-adjusted management structures. So, the priority is always on delivering to clients, and there's an identity between the peers and the clients, because we generally have a pretty good understanding of what they're experiencing in the moment. And combining that with, real professional services that are available through TNG is kind of a winning combination, and it's been an absolute life changer for me. As you heard a little bit earlier, I came to this very late in life. I guess during COVID, I realized that I'd become really disconnected from the people around me, that especially when everybody else went into lockdown, my life didn't change. I was basically the same person, but with fewer interactions, and I began to feel much more isolated. I started trying to help out at church a lot more and starting to help out in the community with vaccination clinics, and I realized that there were literally hundreds of people doing it in my neighborhood that I'd never met. And so I got to be part of that and got to work with them. And most recently, I was in Toronto Western Hospital as a peer and working there in the emergency room, helping people that were, often pretty confused and not knowing why they were there, understand why they were there, helping people that needed to be there but were afraid to go, to find the confidence to go, helping to communicate between doctors and nurses and patients and different healthcare needs. And it was really kind of an amazing experience. I would say that it's, for somebody who has always been a fairly religious person and who tries to put faith into practice, I had never actually had an opportunity to work in an environment where that was so entirely consistent with my faith. I mean, distinct from, obviously, but so consistent with the things that I needed to bring myself back into something a little more productive and healthy. So I just want to make sure I don't leave out the thing that I wanted to talk most about. So I think Amber's sort of outlined what TNG is able to provide and how wide their services are. But something that didn't get mentioned, and I just want to make sure is included, is the ability to respond mid-plan as things change in the community and as things come up in the neighborhood. I mean, nobody can predict when a supply of particularly toxic drugs arrives in the neighborhood, how to spread the word about it so that people in the neighborhood know that something is off, how to detect that there's something and respond to it directly. The Kensington Market Overdose Prevention site, which is based at 260, right next door to the Peer Center, is an amazing resource, and they've been able to respond to overdoses all around the neighborhood. So even people who don't take advantage of that service have benefited from it. It's that kind of connection to the minute-to-minute activity in the community that's really, I think, partly supported by peers, but also that peers really respond well to, and that makes it a very positive and constructive group that's just, it's been amazing. It's been amazing. Another area where that responsiveness has come up is in looking at encampments and how to respond to encampments. And very early, as encampments started to pop up more and more in the neighborhood, TNG was able to get involved and send outreach workers directly into encampments to meet people, to figure out who's there, and to help them to understand what might be available to help them through the city or through other agencies, to help them get ID together, to help them to make sure that they'd access some of the services that could help, and to build trust between the people that need those services and the people providing them. In that case, it was a lot of services offered directly through TNG, but also connecting people to the Streets to Homes outreach teams in the city. And we've had amazing success helping them build relationships and helping them find ways to establish themselves and keep their integrity while doing it. So that's also been amazing. I could talk for about 7 hours. Is there anything specifically that we want to cover?
Okay. You know what, as Andrew was talking, I was thinking that what might be helpful is we can sort of give you a little bit of a day in the life of. Okay. So I'm going to go back to a couple of examples, and Andrew, you can fill in the parts because you were at the other end. Okay. So often on Wednesdays, we do refer to them as Wacky Wednesdays at 260, and the reason that they get so escalated and, well, I shouldn't say escalated, energized, is because in addition to having our nursing on site, which we do 4 days a week, on Wednesdays we also have our doctor on site. And so our doctor is connected with many, many people who utilize our drop-in services. Sometimes he's the only primary care professional that they've been in contact with in decades. And he is amazingly dedicated and thoughtful. And so on days when the doctor's in, I should say also, about every day we serve 200 people. So we have a chef. Chef Mike is amazing. He shows up every day at 7 o'clock, prepares. We do breakfasts and hot lunches. People rave about his cooking, and he is so proud and respectful of all the volunteers and the peers in the kitchen. This was a regular Wacky Wednesday, I believe. And unfortunately, this person has passed away since this. But he arrived, he was a regular client, he is known to many. He arrived after having both legs amputated, in a wheelchair, from hospital, literally dropped off in front of us. And there was a lot, he was known in hospital, challenging person to engage at times, however, very well known to us and definitely deserving of the help that they needed. I think Andrew was there that day. And one of the wonderful things about having peers working in all places within the organization is we're able to connect with this person at the drop-in. People who knew him, were familiar with his story, were able to talk with him, engage, convince us to call EMS to go back to hospital. Upon arrival back at hospital, Andrew was working as one of our peers in the ED, and he was able to sort of pick up there. You tell them what happened then.
Well, I'm going to make a confession. It seems like an appropriate place. I don't know which day. I remember the story very clearly, except that this patient came in every day.
That's true.
So it's difficult for me to know which
I just
day.
know it was a Wednesday.
It was a Wednesday. So that limits it to about a little less than 20%. This patient lived in a wheelchair. He didn't have any shelter. He was not allowed near or in any city shelters. He was too high maintenance. His medical requirements were too extreme for any shelter to agree to host him. His ODSP worker was reduced to taking cash out and meeting him on the sidewalk periodically because he was not allowed in the ODSP office. When we met him, when I first started as a peer in the hospital, he was one of my most important patients, and he still had legs. Over the course of a year, they disappeared. He never recovered from that surgery, and in the year that I knew him, he was never inside except when he could get into a drop-in. And one of the few places that he ever felt safe was actually 260. And one of the few places that never turned him away was 260. That's the old St. Stephen's Community House, or current DNG West site? Yeah, I don't know. But he was known to so many of the peers, and so many peers were able to see him coming down and they could call ahead, or see him stuck in the park and somebody would push him one way or another to get him to somewhere that he could be. I was lucky enough to find him in the park a few weeks ago, and when he wasn't allowed at one hospital, I took him on the streetcar to another one, and he died there the next day. So we're trying to figure out how to help his family now, and that's, again, one of the things that we can do, because we cross so many silos and divisions and boundaries, and we're allowed to work with an exclusive priority, and we don't have bureaucracy to deal with. We have Amber. Amber can cut through tape, and in a way that's phenomenal, and always supports direct work with clients. And as much as I'm personally really upset about this client, and there are so many things I wish I'd been able to do that were just beyond me or beyond us or beyond everybody. I do know that we have really proven to him that there was somebody that cared whether or not he was there, and cared whether or not he was well, and didn't care where he had come from or why he was in the position he was in, but only that he needed support, and we were able to provide that. And that's at once humbling and terrifying and confidence inspiring and satisfying. So it's, yeah.
It's a bittersweet story, but it really shows the kind of incredible connections that people make with folks that often nobody else can connect with. And so I also, of course, there's a lot of work to do, a lot of unpacking to do, all of the system failures, all of the advocacy that comes after this. Saw it coming 500,000 miles away. However, in the moments we were there, and I think one of the strengths of the work that we do in our community through UHHS are these connections that we're talking about. From the park to the encampment, into the hospital, back to the drop-in, convincing folks to see our doctor, engage with our Toronto Community Access Team, which is a high-intensive case management team of folks who have expertise in working with individuals who are homeless and who have mental health as well as substance use issues. So even when, I also don't want you to be disillusioned. We have many challenges, and if we don't call 911 at least 2 to 3 times a day, it's pretty significant. So there are a lot of things happening on site, but even when we come to the place where we have issues and we need for folks to take a break for a couple of days, we have a transformative, restorative approach that allows people to sit down, talk about what happened that led to that event, make some agreements about behaviors going forward, and we always welcome people back. In the 2.5 years I'm there, week to week, constantly, Amber needs a break for a couple of days. She's going to come in on Wednesday, make sure she speaks to this person, we're going to come up with a plan. So the low barrier access really has created some incredibly respectful connections with folks who would normally not engage, and I'm very proud of that. The other amazing thing about UHHS and TNG, as Andrew sort of alluded to, we've been able to do very high-level, purposeful advocacy and social justice work, while at the same time ensuring that that is informed by what's actually happening on the ground, by the people who are actually doing the work and having these experiences to educate us. So I'm very grateful for that communication and that opportunity. And yes, it's, as mentioned, I was working in corrections or side corrections for about 22.5 years, and I thought, it's terrible, and I could stand up here and talk for all day about the tragedies of how that system has failed. This is an entirely different scenario, and my background, was also research looking at the correlation between homelessness and incarceration. And so I see this play out every day. And it's sad to think that often when I was going into jails and going into prisons and visiting with folks, that was seeing them at their best. They had a roof over their head. They had probably gotten more sleep, not much, but more sleep than they'd had in many, many days leading up to that. They may have even been on their medication again. And then they're released back to homelessness, and unfortunately, we see them then. And it turns into a vicious cycle, not just corrections, but so many systems, including healthcare. So we work very hard to interrupt those cycles, and sometimes we're successful, and those are very proud moments.
And even when we're not immediately successful, it is impossible to have an interaction with TNG and not walk away understanding that you were heard, and knowing that when you go back, you'll be heard again, and that there is a way to translate what's available and what's formal to what's applicable and practical. And I think that is one of the core unstated values of TNG. I mean, it's not axiomatic. It sort of rises out of the core values, but people do know that they're heard, and they know that they can access things through TNG that aren't necessarily provided by TNG, but that can be explained and made relevant and made appropriate with some modification that advocacy from people like Amber has been supporting. So, yeah.
And one last thing, before I ask if there's any questions and answers, and we're happy to talk with folks if you'd like. Andrew mentioned our overdose prevention site in Kensington Market. So I want to let you know that that site has been operating for years with zero funding. We survive on private donations that, of course, don't cover all of our needs. We have had over 600 different people using that site. I don't remember a day when I was there that our team did not reverse at least one overdose. And it's not just in our building. We all have walkie-talkies. Sometimes our staff are doing outreach out back at the encampment. They call for our overdose prevention team, and they come with their crash bag and they run down the street and they save people's lives every day. And we get to see that, and I get to see that, which makes it a little bit easier to get up in the morning and do it. So thank you so much for inviting us, and we're happy to answer any questions or any comments you may have. I think I can speak a little bit to the process, and then Andrew can speak a little bit to what it actually looks like. So what's supposed to happen is that individuals who are homeless are able to go to a shelter run by the city, and in that space, they're supposed to be able to connect with housing workers. Housing workers are supposed to be able to find appropriate and safe, affordable housing for these individuals. Often, it means that they require a very long wait for both rent geared to income units, but also supportive housing that has staff on site to help manage substance use and mental health issues. So it's a very long process, but in the meantime, people are responsible for replacing their original identification. They are responsible for ensuring that they have filed taxes. They are responsible for making sure that they don't have any debt owing to Toronto Community Housing. There are a whole bunch of obstacles that people really need to be able to navigate. Often, this is very challenging. When we do have units or opportunities for people that are out of the community, very sadly, they just return. So although they may have arranged for a unit in Scarborough where their rent is being paid directly to the landlord through ODSP or OW, the truth is they're still in the encampment because their community and their supports are there. So moving people into housing is part of the issue, giving people a roof, but that's not a home. And that's not the answer. And people still need connections to community to be able to be supported where they live. There's a question about why the city's approach has been to destroy encampments, despite the fact that people identify with communities in those spaces. So I'm going to let Andrew speak to the first part, and then I have a feeling this will be integrated as well. But for the most part, it will be argued that it's about safety. But let's go from there.
I'm so excited about both of these questions. That there is actually a thread that I can start and link to. Am I?
There you go.
Is that better now? Okay. When I started at TNG, it was a little over 2 years ago. My job was to go to encampments directly and to see if I could help and really identify what help looked like and how to make things better than they were. But there was no specific assignment. There was no get 14 people to sign up for this thing, make sure you have 14 of them housing ready by next week. There was no specifics. It was go into the encampment, offer them whatever you happen to have, whether it's chocolate bars or hygiene supplies or t-shirts, and see what they need and see if there's a way to help them express what they need to an audience that can do something about it. And there was one resident that it took almost 6 months to build up some trust with, who was a regular attendee at the drop-in, and I'd known for years before that, but really took a long time to build up trust with. Eventually we did, and eventually he built trust in the Streets to Homes team, and the Streets to Homes team built trust in him, and the thing went. He ended up housed in Etobicoke, in what I assume is a reasonable place, but he had no support, no friends, no community access there, and so he would come back to the Kensington Market every day, and he would bring his dog sometimes, he would not bring his dog other times, and he stayed in contact and stayed in the community. He eventually became a peer and started doing what he had experienced, and started he was pretty great. He really understood what was going on, and he was only a year out of experiencing it, and he was doing really well. I lately have only seen him near the encampment that's by the church on College Street, and it's an encampment that I've been pretty directly involved in through TNG and also independently for a couple of years since it started. And he found community there that was worth coming from Etobicoke for. So he's often there, and there's so many people that do come to encampments, even if they don't have a place there. They either come to share a place with somebody else, or they come to spend the day. And we don't have cafes anymore. We have one or two Tim Hortons that close at 10. We don't have public spaces much outside of libraries that people can use. And so, that really helped me to frame encampments in a way similar to what you're describing. And I think Lo, one of the TNG people that is just absolutely amazing.
There are one mental health case manager.
Our incredibly productive one mental health case manager who has worked absolute miracles, and helped people transform their lives every day. It's amazing. But she helped me see that describing an encampment as a place where the residents have set norms and standards that are appropriate to them and that are based on an understanding of each other. Adding to that the kind of knowledge of others that you can get by living with them for periods. And then watching carefully and seeing that some people stay in encampments and other people benefit from them and then move on, and other people come in. I'm a huge believer that unless we can offer something today that is more supportive or more appropriate than an encampment, that it is absolutely wrong to disrupt one. That in that community they have found not just each other, but a system that they can find stability in. And I've seen amazing progress that people are making. And I've seen others that haven't been as lucky, but I interfering with an encampment brings a responsibility to, and we'll go back to the flow here, ignore the term housing ready. And in the city of Toronto, there are some amazing organizations that, like within the city government, there are teams that have amazing priorities, do amazing work, but they're constrained by concepts that are rooted in fairness, but that are totally impractical and have become punitive. So to be housing ready, as Amber stated, you need to have filed your taxes for at least the last couple of years. You need to clear up any debts or outstanding problems you may have with the TCHC organizational division. You have to have ID. That ID doesn't just establish your name and your birth date, it has to establish your status in Canada or your status in Toronto. Often there are specific requirements for ID, that it be a driver's license or a birth certificate. If you're lucky enough to come from Alberta, it can take 6 months to get your birth certificate sent. With all the advocacy in the world, it's very difficult to make that faster. And while you're outside living in an encampment, the clock is not ticking. You are not homeless. You're homeless if you call Central Access and get a space, or at least there's a record of you calling to try and get a space in shelter. If you've given up on shelter, if you've been told that you're not welcome at a shelter, if you are victimized in shelters, you are not homeless. for the purposes of being deemed housing ready. There are organizations like ours, and there are people like Amber who are trying to change these policies to try and make them more adaptive. The church on College Street has been lobbying to have time in an encampment considered homeless time for the purposes of those calculations for 2 years. We were involved in a lawsuit that still couldn't establish whether that had been considered or not. And part of it is that people that are as articulate as you are with explaining the reality of things can't penetrate the bureaucracy and can't openly say a policy that is clearly designed to ensure fairness is doing exactly the opposite. We need to change it without undermining the people who put the policy in with good faith. And I think that the people that put the policy in with good faith should be shown the respect that they deserve and allowed to undo the policy that's become ineffective. So I don't like to vilify them. I don't like to say that they shouldn't, but I completely believe that we shouldn't, as Torontonians, be disturbing something that's working better than what we can replace it with. And if we need 4 years to build something that's going to be sustainable, for those 4 years, the best thing we can do is get out of the way or just support and try and address the problems that everybody sees in an encampment without making it worse by taking 14 fire risks that are in one location right across the street from a fire station and turning it into 14 fire risks that are spread out in people's backyards or in laneways or without any supervision and any support if there's a fire. Sorry,
Oh, that's great.
I got a little...
No, that's really helpful. And I will say, in addition to people, making policies with best of intentions, there are very real risks in encampments, and I will say, having worked closely with one of the fire chiefs who's been incredibly sympathetic and helpful, he and I have talked privately many times, like we have nightmares, really, about people burning in their tents. And so that is a real terrifying reality that also has to be balanced with the other kinds of needs in the sense of community that we're talking about. And so there's no easy answer. But especially in the winter months, I mean, there were combustible, lots of propane tanks and barbecues that we'd removed. Like it was a matter of safety. The other thing that keeps me up at night, this is all happening up against a beautiful old heritage building that is this fabulous church. And so there is a real fear about what should happen if there's a fire and the fire spreads and the church would be destroyed. And I don't know that they would have the funds or the resources to rebuild. So, I mean, those are some very serious risks as well, right? So everything has to be taken from a balanced perspective. It's not easy, that's for sure. Yeah. Thank you, that's a great question. So I'm gonna give you an answer, and I'm sure Andrew will be able to expand on it because he's been directly working with the church and doing their best to do what they do. But my short answer is, I think the most important thing that people can do who are faith-based or who are of this mind can try and be louder than the people who don't see it the way we do. And that means trying to have meetings with your representatives because it's likely that they will listen to you. And it's likely that if there are enough voices pushing things like the policies that prevent us from having tiny home communities like they do in other places around this country and, of course, all over the world, we should and can do those things, but it's a matter of reversing policies and rules and removing all kinds of red tape that exists from terrible planning that happened in the 70s and hasn't been changed here in the city. So it really does become about bureaucracy, and fortunately or unfortunately, many people who make up congregations and churches are the same folks that have the power to get in front of representatives and use their voice. And so I think that is probably the most powerful thing that congregations can do.
Okay, if it wasn't obvious before, somebody with zero experience gets to work directly with Amber. Right? Like, That's why peers are successful, because we get to work in an environment that is absolutely based on results. So, sorry, wanted to say thank you. I'm actually working on, I was the lay delegate to the Anglican Synod last week for St. Stephen in the Fields. I don't know if you're familiar, but it's on College Street, halfway between Spadina and Bathurst. We have an encampment that's been in our yard for a couple of years. And in that time, I've spent a lot of time talking to different groups about how we can be effective. And there are lots of ways, but a couple of them stand out to me. We feel an intense pressure to get it right when we involve ourselves in somebody else's problems. And that can be debilitating, right? We can see somebody, if they're right in front of us, we intuitively know how to help. Intuitively, we either know to call 911 or we know to say, hey, are you all right? Or, do you need a coffee? When we switch that and go out to find somebody to help, we feel inadequate, generally. We don't know what they need. We don't know how to help them. We know we want to. They don't. How do we connect to somebody in a way that allows them to know that we want to help, and in a way that lets them tell us what they need so that we can help? So there are a lot of ways to address that. One is fear of performance. Like, if you're willing to do something, just know that very, very, very few other people are, and chances of that person seeing somebody who's willing to help today other than you is zero, basically. I mean, very few people are able to help or think to help or take that step to try and help. And there are a lot of ways. I don't want to go into it now. It's a very long topic, but there are a lot of ways to help us work together to overcome that barrier. The second is organizationally. How do we, as major landowners, as communities that care, come together and make meaningful, lasting change? And I'm in a building right now that is adorned with something that tells me that you are committed to making meaningful, lasting change. So I'm sure that you've had these debates in your vestry meetings about how to use the resources that we have to make changes. And that planning is incredibly important, and it will result in something that takes years to implement. So while we're doing that planning with urgency and with effort, and coming up with what we'll do over the next decades, we need to remember that we can act without infrastructure. We can act as individuals. We can come together as a group and act without planning, if we can address some of the barriers. And one thing to really be certain of is that getting to a place where somebody can tell you what they need is the first step. And saying that you can't provide what they need is a valid response, if it's a genuine statement and if they hear you and they know they've been heard. And that lets you move into things that you're able to do. One of the hurdles that I had to deal with very early in doing outreach is that what I identified as the big problem was never the thing that I could do anything about, wasn't the thing that they wanted to focus on today, wasn't something that they were ready to address. And it wasn't until I learned how to listen for something that was achievable that I could build up trust, that I could build up the kind of relationship that let us do really amazing things. So I would say that funding organizations that are doing it is a huge step and very important. I'm not underplaying that at all. Learning from those organizations how you can implement a tiny part of what you wish you could do is an amazing thing. And coming together as community and looking at resources that you can bring to bear, looking at barriers to bringing those resources to bear, and recognizing that as a group we act in two distinct ways. We act in a long-term planning way while we're doing immediate responsive outreach. whether that's wound care for somebody that's got an infection in their arm. And there are people that I see every day and talk to every day, and the only reason that I have an excuse to talk to them every day is because I show up with Bactine and make sure that they've got, all their wounds cut. And the Bactine's not helping at all, but wound wash and Bactine are that's my gig, that's why I'm there. And while I'm there, I can make sure that they connect to Lo. I can make sure that they connect to Amber or Nadia or somebody who really has the ability to help them integrate into a more systemic support. So my answer is twofold. Long-term planning, making sure that the mission of the group is what is the key factor in land use and in dedication of resources. And short-term, finding ways to help each other overcome the barriers to helping in the ways that we're able to.
Placebo effect of the Bactine.
Yeah, I actually may have at some point used a colored liquid and water to refill my Bactine, but it's only because I'm not certified.
So, yes, that's a huge issue. And I will share with you that on Bellevue, there are 2 daycares. One is at number 91. It happens to be a TNG-run daycare. The other is a little bit farther up the street. It's a private Montessori-run school. I've had meetings at both. What I will say is I believe that some folks are genuinely fearful. They are afraid about people who are loud or cursing. They're understandably distressed about people urinating in public or leaving discarded needles. Absolutely. Those are very legitimate fears and concerns. Our response has been to make sure that we have the needed resources to hire people to do more sweeps of the area to pick up the needles. We have folks that go out into the encampment to talk about, at this time and this time, that's when the kids come. It would be really helpful. I think there's an opportunity to engage. For my own children, that's an opportunity for education. Yes, you can go to the park. And yes, you can use those things. And by the way, do you know when we're walking past this? This is what I want you to know about it. So I can appreciate the fear and completely, as someone who lives in a home and owns a home in this city, of course I'm very protective of my property. Yes, however, I have to acknowledge that as part of this community, those folks are part of this community too. And that's sort of the way that I try to frame things. So I think by talking to people about the fact that they may be engaging in behavior that others are uncomfortable with, that's been the most useful thing for us. Yeah, please.
I think you were reading my mind a little bit, because that's an issue that I've been dealing with a lot. On Friday, there was a lot of activity at the encampment by the church, and I ended up doing a whole bunch of interviews with various radios and whatever. One of them was on 680 News, and I think that the host people that heard it told me that the host came off as hostile. I didn't hear her as being hostile. I heard her as being frustrated. For people to look out their window and see an encampment is for people to look out the window and see stitches healing on their arm coming apart, or see a symptom of a major failure. And the natural reaction to that is anger. But there are 2 causes. One is a sense that this shouldn't be. And the other is that the solution is worse. When we feel that we're forced to advocate to either keep encampments forever or end them, then we have to choose a side. And it makes us feel like bad people when we say the encampment has to go. If we're not conscious of that, if we don't recognize that our response naturally makes us feel like we're bad people, then we don't discuss it. We look at all the reasons we're right. We look to defend our position so that we're not bad people holding this position. it's the position that's invalid. Nobody's arguing to keep encampments forever, and nobody's saying that there should never be an encampment. If we're going to pull ourselves up by the bootstraps, we need to stand somewhere. Looking at ways to understand the different kinds of encampment residents and the different kinds of pressures that drive people into encampments helps us to recognize ways that we can help and ways that we can credibly say, we want these encampments gone as soon as possible and not a minute before that. That nobody should have to make that choice. That the worst self-deprivation you'll be forced to is a place that's safe. But until we can say that, we have to accept that our personal failure as citizens in a place that hasn't been able to solve any of these problems in hundreds of years, and also our fear of not being able to act the way that we wish we could. And that goes to some of the things we were talking about earlier with, overcoming some of the barriers to helping. And I think that if people are given a genuine opportunity to help, that they are naturally drawn to ending encampments by solving some problems, as opposed to ending the issue at the end of my street. Sorry.
Well, yes, one of the most exciting initiatives that we have is the city is finally very interested in, or once again, continues to be interested in modular housing opportunities. And I understand that there are sites across the city that are very, very close to moving forward. And so I would say that that is a very exciting opportunity. Also refer back to the modular housing on Macy and on Dover Court that we are also involved with. Those have been sometimes challenging, but overall successful models. And so I think the most encouraging thing is that the city has come to a point where they know they need to build housing, and what they've been doing isn't enough. Yeah.
I think that the sign of a good program is that you've barely heard of it, unfortunately. There are a bunch. And there are some that are having immediate impact, but I think more optimistically, we could talk about the projects that could be approved now and come online in the next couple of years. I think that's where the biggest promise lies. That's where we will see major impact. These modular kind of test projects could flourish, and we could see real solutions to having a secure and supportive system for the people that need it. So treading water while those things happen has always been the mode, and I get the feeling that some of those things are happening now in a way that they weren't a few years ago. So.
Yeah, and I just wanted to add that I think, importantly, many of the hospitals have finally recognized homelessness as the health issue that it is. And that has been encouraging as well. There are large hospitals that now have social medicine departments that are focusing on some of these issues and population-specific health needs. And I think that is very encouraging too. So that is a really good point, and another advocacy issue. So here in Toronto, we have Access Point. An Access Point is well, many things, but it also houses a very long wait list for people who are looking for long-term intensive case management support. There is a huge need that we also can't seem to meet. Through Streets to Homes and many of the city initiatives, folks who are moving into housing do have at least 12 months of follow-up support available to them. Many of the other organizations that were previously involved with those people do tend to stay in touch. That is part of the purpose. In some of the housing that TNG is responsible for, we've been able to do other things on sites, like community kitchens, like having peers attend to help get people out of their units and build community and provide support. We also, as I mentioned, have the TCAP program. Many of the case managers work with folks who have access to some of the supportive housing units through the intensive case management program. Also, across the sector, there's an understanding that when we talk about housing with support, there's a continuum, and that there are some times when supports have to be stepped up, and other times when people are doing well and they can be set back. There are some people who will need support forever, and there are others who just need to get past this place. So the whole idea is that the support is to be able to move with the person along their journey. But yes, follow-up support is integral. Yes, of course, and peer support. So that's another thing I wanted to say. Some of the most recent innovations we've had has been introducing peers into some modular housing where there have been high incidents of overdoses. And in addition to having staff, we also have peer support workers who are available, in some cases, in the shelter hotels by phone. They can attend people's rooms, they can witness their use, they can intervene in overdoses. They can be called to say, okay, this is Amber, I'm gonna use, if you don't hear from me in 15 minutes, please come check on me. So, and by establishing relationships with people who have those shared lived experiences, it's much easier for people to reach out for help. So I think establishing peers within these places where folks are moving in, settling, going through transitions is incredibly helpful.
Here, but thank you so much on behalf of Blair Street United Church, St. Matt's United Church, Holy Blossom Synagogue, and Davenport Perth Community Ministries, because that was a really interesting and inspiring talk, and I think it took a nice spin on an issue that we know has been pressing in our city for a long time, but made it feel hopeful too. Like there are things we can do and work that you clearly are doing right now, which is very valuable and important. So yes, applause? Okay, applause. Thank you so much for coming.